by, and then we're also joined by our attorney, Michelle Fossum. And so we will proceed. So the action items that we have before us are interviews related to the three distinct positions that exist on the Board of Health. And we're going to kind of do a little bit of a hodgepodge based on availability. But the three positions are healthcare representative, public health or healthcare representative, community stakeholder, and consumer of public health. And so with that, we will jump into our first interviewee, which is Dr. Gretchen LaSalle. And we do have 6 questions here that we've put together. And so do we want to just go around the room then and ask these in order? Sure. Because I don't think we, I think we'd had them identified in the last meeting, but I don't think we have that list right now.
Start with Josh, sure.
So whoever would like to go first. Josh, would you like to go first?
Sure.
All right.
Make sure it's the same question.
Yeah. Yep. They're all the same.
Okay.
Hello. Welcome. I'm County Commissioner Josh Kearns, and I have the first question here that I will ask for you. And it is, how do you define public health? Why do you believe it is important to our community? And what is your understanding of SRHD's programs and their role in the community? Are we muted? Gretchen, can you hear me?
Dr. LaSalle, can you hear us?
I don't think she can. Okay.
Oh,
Patricia, can you hear us?
you can hear.
Oh,
Okay.
Patricia can hear us.
Yes, I can.
I can hear you. I can hear you.
All right.
Okay.
Maybe can we send her a message? You did. You nailed it. Dr. LaSalle, are you able to hear us? Will you hold up a piece of paper, maybe? Well, apologies for the technical difficulties for folks who may be watching the stream. I'm trying to sort through this.
There's a cell phone. I'm trying to call her. Okay. What has it really done for us?
Dr. LaSalle, are you able to hear us now?
Are you one of our applicants later on in the process? No. Oh, okay.
Now I can hear. Yeah.
Hey, very good. Okay. You can
Okay,
hear us?
thank you. Alrighty, bye-bye.
You can hear me?
Sorry
okay?
about that, folks. Yeah, now I can hear you.
Wonderful. Okay. All right. Well, apologies on the technical difficulties there.
Oh, might have been on my end.
So, Dr. LaSalle, we've got 6 questions here for you, and we're just going to go one by one and ask these prepared questions. And so we will kick this off with Commissioner Kearns.
Hello, I will ask the first question, which is, how do you define public health? Why do you believe it is important to our community? And what is your understanding of SRHD programs and their role in the community?
Okay, well, thank you. Nice to see everybody. Thanks, first of all, for this question. I thought it was a really useful exercise to go through and think about how I might define this in my own words. And so how I view public health is as a discipline that works to ensure the health and well-being of the community as a whole, but also as of the individual through that community lens, through things like disease prevention, injury prevention, emergency preparedness, health promotion, both physical and mental. And I think it really acknowledges and honors our interconnectedness as individuals, but also with our environment. So the natural environment, but also our socioeconomic environments and the cultural context in which we live. My understanding of the role of the Board of Health is that it oversees the activities and functions of the Spokane Regional Health District, and it has a fiduciary responsibility, so a budgetary oversight, that it helps propose and maybe set policy around public health initiatives, but really is there to listen to and reflect the priorities of our populations when it comes to their goals for their own health, with a particular eye on focusing on addressing health disparities for those populations that are underserved or marginalized.
Thank you very much for that response. We'll go to number 2,
You're welcome.
Commissioner Jordan.
Okay, question number 2 is, what expertise and life experiences do you bring to the board that will be beneficial to representing our community?
So I've been a practicing family physician here in Spokane for going on 20 years. And so I think I have sort of a day-to-day boots on the ground understanding of what our patients our population is struggling with, and the social determinants that play a role in their health. I have a wealth of experience in vaccine education, and public health is much more than just vaccines, but that's an important topic these days. Vaccine education, particularly with respect to science communication around vaccines and other health topics, and working with vaccine hesitant populations. I just completed my master's in public health too, so that has sort of opened up the all other sorts of interesting topics for me in the public health realm that I feel passionately about being involved with. I think I've been involved with the Spokane Regional Health District, particularly more during the pandemic, partnering with them to do, and Dr. Velasquez to do like Facebook Live sessions. I've partnered with folks at the state level with the Department of Health doing webinars, really just trying to be a trusted resource for people during a really stressful time of the pandemic, and trying to get good information out there, answer people's questions, help allay fears. And I would like to think that I've become sort of a trusted and respected presence in the community in that respect. I have sat on numerous committees and was on the Multicare Rockwood Board of Directors for 2 terms. And so I have board experience and committee experience, both locally. Just this morning, we were meeting. Multicare has a vaccine misinformation task force that we've started. Met this morning. At the state level, I sit on the Washington State Department of Health Vaccine Advisory Committee and the Washington Vaccine Association. Nationally, I was, up until the big changes happened at the ACIP, I was sitting in a work group for the ACIP looking at the adult RSV vaccine. So I have this local, but state and also national perspective that I think would be helpful to the board. And I also am not afraid to have difficult conversations. And I know people don't always agree when it comes to topics of public health. But I think one of the reasons many of my patients who have remained with me despite my annoying persistence of talking to them about vaccines when they have declined in the past is because I do so with respect and humility, and trying to meet them where they are. And so that's how I approach any difficult topic. And I think that would, I would bring that to my function on the board as well.
Thank you.
Yeah, thank you very much. I will ask the next question here. Identify with specificity one significant current public health issue and one future public health issue facing Spokane County and your thoughts for addressing those issues.
So the current one that I see day to day with my patient population is just shortage in specialty care, primary care as well, although they have me, so they have a primary care provider, but finding people to see our patients who need specialty care has been a real challenge, and that's across multiple disciplines. Mental health, of course, is a big one. And I'm very gratified to now know, I know this may have been going on for a couple few years, but to know about the Safe and Healthy Spokane Task Force that's at work to address some of these needs for mental health and substance use disorders and other issues in our community. I would love to see I'd love to see a similar sort of task force with multiple stakeholders involved, including, the major hospital systems that we have here in town, Multicare, Providence, Kaiser, Kootenai, Chaz, et cetera, sitting down and really doing, making a strategic plan, looking at the city's needs for medical care and seeing where we already have adequate numbers to care for our population and where we are struggling, and working really as a community organization or task force to fill that gap, a SWOT analysis, sort of, what are our strengths, what are our weaknesses, why are we having trouble recruiting to Spokane, because it's really a whole city issue, not just one hospital system or another. And so I'd love to see everybody working together on that to solve that problem for our patients who are currently having delays of care, or maybe not even getting to be seen here locally and having to travel, which of course, to the west side or other places, which only increases disparities for our patients who already see disparities in their health care. Future issue, and really current issue as well, but future if we don't continue to work on it aggressively, is the rising rates of vaccine preventable diseases across the country. Of course, we're all familiar with the measles outbreak that's happening. And just locally, I'm concerned about what's happening next door in Idaho with their change in moving vaccine decision-making from the Board of Health to the legislature, and then getting rid of vaccine requirements for school. What happens in Idaho comes to Washington. And so I think really, this is a harder one to sort of make proposals for, but I think if we're not already doing so, and maybe we are, I'm just not privy to it, but working cross-jurisdictionally, even across state lines, to work with, Idaho departments of health, and then our other jurisdictions here in Washington, and maybe dig down more granularly when we are looking at immunization rates and how we can improve those immunization rates to the individual school level. When we look at county levels or school district levels, there can be a false sense of security, and we can miss little microclimates of risk that happen at school levels. And so I would love to see personally medicine partner with schools. And I know we're doing some of that with some of the clinics that are now housed in schools, but even more so to provide, partnerships that might benefit both the clinicians and the kids at school and their families, whether it comes to vaccines or even other social services. As clinics, we have medical homes where we try to provide social services for our patients. But I think the schools are a place where people who don't have clinicians we might be able to reach them there. And so, offering more through the individual schools themselves is something I would like to see.
Great. Thank you so much. Commissioner Brooks.
Thank you. So my question is, describe your experience on a board or committee and how you handle decision-making when faced with differing viewpoints from fellow board members.
Good question. So I have had board experience. As I said, I sat on the Rockwood board for 2 terms. And I luckily have not had a lot of experience with major disagreements to give you an example of, but I would say that I think good leaders and good board members do more listening than they do talking. And I think just trying to really understand where people are coming from. And this is what I do every day in my patient encounters when I'm talking to folks who are hesitant about vaccines or some other medical intervention, is really trying to listen and understand where they're coming from, get their perspective, what are their experiences that have led them to that perspective, and meeting them where they are. Is how I would approach that. And we just have to remember that, and this did come up on board service in the past, is, each of us, primary care, specialty care, and different specialties within specialty care, everybody has their own sort of needs and wants and agenda for our board that I sat on. And we just had to remember that we were there to serve the whole, and not individual interests. So that's kind of how I would hope to approach those issues. And it's worked for me in the past on a one-on-one basis, and I think it would work in the board setting as well.
Thank you so very much. And Commissioner Waldron.
Hi, doctor. Thank you for applying.
Good.
The Board of Health meets monthly for 2 hours, sometimes a little longer. And there is also committee work that can take 2 to 4 hours per month. Do you have the time and flexibility to take on this responsibility in a consistent and prepared manner?
Absolutely. So as I mentioned, I was on a work group for the Advisory Committee on Immunization Practices, and we would meet 1 to 2 times per month for 2 to 3 hours at a time. And there was often reading and things involved before those meetings to get prepared. And so that unfortunately is no longer happening, but so I do have time. I also happen to be, now that I'm done with my master's, that's freed up time, and both my kids are now out of the house. So I am walking around bored. So I'm looking forward to have more to do with my time, and I would love to give that time and service to the city of Spokane.
Thank you.
Thank you so much. And we've got a couple of minutes left here. Are there any questions that you have for any of us?
Yeah, so I am, I'm sort of outspoken sometimes in I think a respectful way, but about my passions about vaccines and public health in general. And I tend to do, a fair amount of webinars and teachings. And I usually will get asked by Multicare. I have a couple of things coming up this next week to do news spots or interviews or, that sort of stuff. Is there any restriction once you're on the board? Do you have to sort of remain more neutral in your public persona? Is there limitation on having that sort of outward-facing interaction with the public, or not? I guess I'll leave it at that.
I mean, I'll let our attorney weigh in as well, but as a past board chair, you can, whatever you want to do in your personal capacity, just as long as you're doing it in your personal or your professional capacity, you're not doing it as representing yourself as the Board of Health member.
Got it.
Unless specifically, as the Board of Health, we're asking, all of our members to go out and advocate or do things on behalf of the Board of Health specifically. But in your personal or professional capacity, you are welcome to do what you want to do.
Michelle, anything you would add to that?
Thank you.
Yeah, I would echo that certainly. It's just important to make sure that, whatever position you're taking, it's clear that you're taking it in your individual capacity and not as a representative of the viewpoint of the board, because act as a whole after a discussion and a vote. So that's the challenge at times.
Yes. Thank you.
Thank you.
That was the main
We've got
question
time
that I
for one
had.
more
Yeah.
question, I think, if you've got any more for us.
I guess I have a question about, I was reading through some of the prior meeting minutes, and it talked about public comments, that there were public comments, but then none of that was written into the minutes. And so I'm wondering if that's ever something you guys have thought about, just sort of in the, for transparency purposes, or what have you thought about in the past about putting those minutes or those comments in the minutes?
Yeah, I would just say, I mean, I think we do, if it's written comment, those do get published, included,
Oh, okay.
or they used to anyway. Is that correct, Ann?
Per the Open Public Meetings Act and different requirements of taking minutes, we do not publish that information, but people can request it through a public records request. It is part of the official meeting record, and all board members receive the citizen input.
Okay, thank you.
All right. Well, thank you so very much for your participation and application. We appreciate it. And I'm not entirely sure the exact timing of process, but we'll be discussing this a little bit further today, and somebody will be getting back to you very shortly.
Excellent. I appreciate everybody's time. Thank you.
Yeah, thank you.
Have a good day. Bye-bye. Those comments in the memo.
I would just say, I mean, I think we do, if it's written comment, those do
Hello?
get published.
Derek?
Included.
Is that your audio going?
They used to anyway. Is that correct?
Per the Open Public Meetings Act and different requirements of taking minutes, we do not publish that information, but people can.
Derek, are you able
request
to
it
hear
through
us?
a public records request. It is part of the official
Might just be
record.
watching the video back.
And I would just, the conversation you all are having is,
If
All right. Well,
Yes,
thank you
thank
so
all
very
of us.
much for your participation and application.
Planning to
We
interview,
appreciate it. And I'm not entirely sure the exact
focus on the live
timing
stream.
of process, but we'll be
delay.
discussing this a bit further today, and somebody will be getting back to you very shortly.
Excellent. I appreciate everybody's time. Thank you.
Yeah, thank you.
Have a good day. Bye-bye.
Derek, are you able to hear us? Derek?
I can hear you. Yes.
Very good. Okay. You got us then? All right. So
Yep.
if you've been watching the meeting, you'll kind of know the process. We've got 6 questions for you. We'll go around the room, and Commissioner Kearns has the first question.
Right, welcome, Derek. The first question is, how do you define public health? Why do you believe it is important to our community? And what is your understanding of SRHD programs and their role in the community?
Yeah, good afternoon. Thanks for having me. I like this question because I was a restaurateur and I didn't really understand the role in the community, and going through my my time with the Washington Hospitality Association and with the role I am now, I really have learned what it is all about. And I would define the public health as a core need that we have to keep our community safe. It's in our everyday lives, whether it comes to the hospital, the clinic, or frankly, the restaurant that you're having lunch at. Where it becomes especially important, I think, is during situations like the pandemic, or a broader food-borne illness outbreak. And I think part of that is education is big in that, helping people understand the risks and prevent problems before they happen. So as to why I believe public health is important, ultimately it boils down to getting ahead of it before it becomes a problem. And at a high level, I think public health is really about keeping people safe and educated. As to the role, I've worked hand in hand with Spokane Regional Health District when it comes to the public side with restaurants. And I think that their role is really providing safety for people that don't necessarily realize the impacts of what public health actually means. And, you know, some of the other questions that I was reading, and we'll get into it, but I think a big thing is the foodborne illness issue and making sure that people are safe, but people are giving safety, like they're giving good food, their hands are getting washed, like all that kind of stuff.
Very good. Thank you very much, Derek. And we'll go to Commissioner Jordan with the next question.
Okay, the next question is, what expertise and life experiences do you bring to the board that will be beneficial to representing our community?
So I think the life experiences that I would bring to the board come down to perspective and collaboration. As a restaurant owner and in my professional role with Washington Hospitality, you know, I represent restaurants and hotels across Spokane County. And I think what sometimes gets missed with that is that I don't just represent the owners. I represent the employees that are in those establishments. And with hospitality being one of the highest employers across the county, you know, those individuals don't necessarily have consistent access to healthcare and or preventative care. So I think that's one thing that I have to, you know, remind our members of is, you know, I'm not just representing you, but I'm representing your employees too. And so I've because of that, I've seen the firsthand how like the public health decisions impact both sides of the counter, whether it be the owner or the employee. And then on a personal level, you know, I served in the Navy, and that really shaped how I approach my leadership style.
All right. Thank you very much, Derek. I've got the next question here. Number 3, identify with specificity one significant current public health issue and one future public health issue facing Spokane County and your thoughts for addressing those issues.
Yeah, so I think, you know, in my world, first and foremost, I think the issue with the unpermitted pop-up stands, taco stands, you know, whatever it may be. You know, talking with Jessica at the Spokane Regional Health District, you know, her concern with it really concerns me. And, you know, she said it's just, you know, right now it's not a matter of if, it's a matter of when we have, you know, an outbreak. And so that I think that's first and foremost, you know, a concern that I have. And for that, it's a statewide. And so you know, we put together a task force to kind of figure out what we can do about that. And we're still working through it. So I don't have a definitive answer on it, but we're working on it. As for the future, you know, I think fentanyl in the broader opioid crisis is not going away. And I think, you know, we need to address the issue with prevention, education, you know, in accordance, you know, with law enforcement, public health. Like if we can do a task force and get everyone together on the same page, I think that's the best way forward with, you know, any public health crisis that we see right now or that we have in the future. And I think we did a pretty decent job of that during COVID.
Commissioner Brooks with the next question.
Thank you. Derek, can you describe your experience on a board or committee and how you handle decision-making when faced with differing viewpoints from fellow board members?
Yeah, so I served as the board chair of the Spokane chapter of the Washington Hospitality Association. And I started that role March of 2020. So you can imagine it was incredibly challenging. And so I didn't really have much when it came to the board, but with our members, and we're a member-led board. So that was a tough time to deal with them because, oftentimes they were angry at the decisions that were being made. And they were, frankly, afraid. And in this industry, when you have a business owner that's afraid, they tend to get backed into a corner. And so I think we navigated our way. I would like to say we navigated our way delicately through that space. And I just think that it was a difficult time, but we turned the temperature down to where we could talk with the members and say, hey, yes, you're at 25% capacity, but look at the bright side and let's do it this way. And within that, we didn't lose any board members, we didn't lose any members. So I think that was a very interesting experience. And then, beyond that, in my restaurant, I use the concepts from the book, The 5 Dysfunctions of a Team. And if you haven't read it, it's a great read, but it reinforces the teamwork and the value of trust and healthy conflict. And I think that's one of the big kind of cornerstones I took from it is the healthy conflict aspect of, yes, we can have conflict because that is something that's healthy. And so instead of letting it boil and stew inside of you, let's sit down and have a conversation and then get over whatever it is. So I think that really helped me. That was the experience that I had on boards and commissions, if you will.
Thank you. And Commissioner Waldron.
Hi, Derek. The Board of Health meets monthly for 2, sometimes more hours. And there's also committee work that can take 2 to 4 hours per month. Do you have the time and flexibility to take on this responsibility in a consistent and prepared manner?
Yes, and I've thought thoroughly through through this commitment, and I believe, yes, I do, and I'm confident I can serve in a prepared and reliable way.
Okay, well, Derek, thank you very much. Those are the questions we have. The last one is simply, do you have any questions for us? And we've got a couple of minutes if there's anything that you'd like to ask of us.
Yeah, I would love to hear, from you guys, what do you guys think the biggest public health challenges that are facing Spokane County within the next 3 to 5 years are?
Fentanyl, that's just me.
Yeah,
Others
overdoses.
I think the spread of different diseases, if there is vaccine uncertainty and the ability to us to have resources here at the district to manage those potential crises. But yes, fentanyl as well, of course.
Yeah, and I guess, whatever it is, we're going to be facing some financial crisis. I truly, I'm going to say it that way. I know people don't like me to say crisis, but I think we're going to be, facing declining budgets from the state, local. And so it's going to be, one of those things I think is going to be an issue for us, so it will affect all of it.
Thank you. Any other questions for us, Derek?
Nope. I just really appreciate the opportunity, and my goal serving on this board would be to represent those in the community that the rules and the board is governing. So I appreciate the opportunity.
Thank you so very much. Okay. Well, we have a couple of minutes. Is our next interviewee online yet?
She is online.
Okay. Well, we're good to just move into that then. We will do that. Okay, so next up in the same category is community stakeholder is Sarah Spear.
Hello. Are you all able to hear me okay?
Yeah, we can hear you. You can hear us?
I can. I've had quite the technology day, we'll just say that. So I was a little bit worried it wasn't going to work. Okay, good.
Well, thank you so very much for joining us and preparing to answer these questions. If you've been watching, we're just going to go around the room. We've got 6 questions to pose to you, and we'll kick it off with the first question with Commissioner Kearns.
Hello, Sarah. How do you define public health? Why do you believe it is important to our community? And what is your understanding of SRHD programs and their role in the community?
Great. Thank you so much. I define public health as really the infrastructure and the backbone and really the fabric to collective health and well-being. It is the bridge between individual support and really collective and system level health and well-being across the community. I think it's really important because it touches everybody's lives. I know for me personally, public health has been a large part of my own individual journey and story, which I'm sure we'll get to a little bit more, but I am a person with lived experience and I've had to navigate a lot of the public health. And so it's important on every level for individual families and the community. In regards to actual Spokane, you guys are the public health authority. You implement and enforce Washington statutes, regulatory compliance and oversight, really the cross-sector convener for Spokane, the region, and the state. You inform policy, quality data, and you run a lot of different programs, everything from immunizations, administering WIC, maternal and child health, communicable diseases, opioid treatment programs, environmental, water, food, septic, emergency preparedness, and again, really kind of being that backbone and fabric to our community to ensure that we have good data, good policy, and ultimately a really healthy city. And I'm proud to be part of this community. I like to call Spokane as my second chance city. So you all have done great work, and I've had the honor of working with the district for a number of years on different projects.
Great. Thank you so much. We'll go to Commissioner Jordan with the next question.
Thank you. The next question is, what expertise and life experiences do you bring to the board that will be beneficial to representing our community?
Yeah, great. Thank you so much. This is a very personal question. I'm very open about my story. I actually have over 16 years of recovery from an IV heroin addiction. So first and foremost, I understand, again, what it's like to navigate those systems. I also had to overcome a number of health issues as a young adult as a result of my heroin addiction. So I know what it's like to have the shame and the stigma with communicable diseases, including hepatitis C, and really what that journey is as a consumer. So that really is the bedrock. And from there, I actually went back to school. I studied international political science with a focus on socioeconomic development and really looking at opioid and drug treatment systems around the world. I also studied cultural anthropology. And from there, I went on to become a consultant, as well as work in executive administrative roles. I've worked on everything from inpatient residential treatments for substance use disorder and mental health, evaluation and treatment units, outpatient, intensive outpatient. I helped develop the first sex trafficking center, the receiving center, House Bill 1775 for commercially and sexually exploited youth. I currently run a coalition called the Bridge Coalition with the Healthcare Authority. I work with Office of Homeless Youth. Been a part of Substitute House Bill 1929, which really is that intersection of homelessness and behavioral health. And we built the first framework under North Star Advocates and established the Bridge Housing, the Bridge Coalition, and help advise both Healthcare Authority and the providers who hold those contracts that are running short-term transitional housing programs for unaccompanied homeless young people exiting out of behavioral health inpatient. In addition to that, I have a lot of experience within the Medicaid realm. I was a Medicaid transformation manager and administrator through the behavioral health Medicaid transformation, the MCOs from the BHAO. So I'm really familiar with funding, again, particularly within Medicaid as well as commercial. So I understand what providers are up against and the landscape of funding that a lot of our service providers have to navigate to provide really important community-based services. I also have extensive experience in PR and marketing and film. I actually used to work in film since I was like 16. My family came from film. So I worked with the Coen brothers on No Country for Old Men, worked for Josh Brolin's production company, PR, media. So kind of just a very large, broad spectrum of skills and abilities. And again, I think the driving force really is my understanding of that lived experience and what it feels like to be somebody who really needed a lot of help with health and understanding how personal it really is to our community and our individuals.
Appreciate that, Sarah. Thank you very much for that response. I've got the third question here. Identify with specificity one significant current public health issue and one future public health issue facing Spokane County and your thoughts for addressing those issues.
Yeah, absolutely. So obviously I'm going to say fentanyl, but I want to say that that's under a larger behavioral health, the behavioral health crisis that Spokane, really Washington State and our country is facing, but fentanyl in specificity. And then I have three areas that I really think are important. I think coordination. We need clear professional and organized referral pathways. We need warmer handoffs, and we need cross-system alignment. Really doing a map on the continuum and the capacity that we have. The reality is Spokane actually has fantastic providers. We have a lot of great services. I do think we have some serious gaps, particularly within the adolescent unit, especially when it comes to residential. We have some great outpatient programs, but we really are lacking inpatient and evaluation treatment for minors and adolescents. And so we're in the guise of a fentanyl crisis and drug overdoses. And so we need to make sure that we have that full continuum of care. And then obviously funding and alignment with policy. I think that we need to make sure that our providers have adequate rates. We need to make sure that there's creative blended funding streams, and then that policy is informed by both people with lived experience, but also the direct providers who know the day-to-day challenges. So I think those three areas, again, that's coordination, continuum of care, and funding alignment are the three kind of keystone areas to help reduce fentanyl overdoses and improve the mental and behavioral health of our community at large. I really liked your other question about a future one, and there's lots of different things we could say. But in thinking about this question, I actually think it's the institutional mistrust and the information shift that has happened, not even just locally, but also on a national level, which definitely also plays into Spokane. The way that our generation, our younger generation in particular, rely on social media for health information. Really understanding how algorithms, it amplifies off of emotion rather than accuracy, and misinformation spreads so much faster than public messaging. And there's really an erosion of trust, I feel like, amongst younger generations when it comes to health and public health and understanding fact from fiction. I have the privilege of working with a lot of young adults across the state. I do a lot of data and surveying. And they really don't know where to often turn for health information. So I think that is one of our pressing issues. I think a solution for that really is to engage lived experience experts. So regardless of what area we're looking at, I think bringing in people who have actually experienced those things to co-design messaging and work with us as we try and find what is the best way to promote informed quality data and make sure that people are making really good health decisions. So I think we need to engage populations with lived experience more, and a broad view of that, right? Whatever sector we're looking at, invite people in to kind of co-design those messaging campaigns with us.
Great. Commissioner Brooks has the next question.
Thank you. So my question is, describe your experience on a board or committee and how you handle decision-making when faced with differing viewpoints from fellow board members.
Yeah, again, another good question. And as I've noted, I've done a lot of bipartisan policy work. So I think those of us who have done policy and understand how to work across the aisle have a skill and an ability to look at conflict resolution. And first and foremost, I'm mission focused. End of story. I'm focused on the mission and I want to get the job done. I'm very solution oriented. And no matter what, I will stay respectful and I will take responsibility for what's mine. I'm not a big debater or arguer. I really like to solve problems. I'm a fixer by nature. And so I tend to try to be that bridge. And I've had the ability, fortunately and unfortunately, of being involved with a lot of different projects. Some went really well and some didn't. And I've learned really valuable skill sets and understanding of how to navigate complex issues when there is disagreement. But again, I think as long as you stay focused on that mission, most of us have best intentions. Sometimes just personalities can get a little bit too involved. So I try to separate myself from that. And that's about as much in depth as I'd like to go on that, but happy to discuss more of that later.
Commissioner Waldron?
Thank you, Sarah. The Board of Health meets monthly for 2 hours or more, and there's also committee work that can take 2 to 4 hours per month. Do you have the time and flexibility to take on this responsibility in a consistent and prepared manner?
Yes, I do. It's actually a really great time. I am a mother, and so my little guy is about to start kindergarten. And I actually am still consultant. I'm the chief consultant, like I said, for North Star Advocates. But I have a very manageable workload. And so this is a really good opportunity. I have not been on an active board member for about 2 years. So I really wanted to be with my son, and now I have more time, and I'd love to be a part of making sure that Spokane stays healthy. And excited about all the work that you all have been working on and some of the new things that are coming online. So absolutely have the time and the dedication to be a part of this.
Well, thank you so very much. Those are the prepared questions, but the last is just, do you have any questions that any of us can answer for you?
Yeah, I actually do. I'm wondering if you all have a strategic plan and any specific goals that the board's working on or plans to work on over the next 2 to 5 years.
Well, I would just say, and I'll let others answer this. I mean, yes, there are a lot of those, but right now we're in the process of hiring a new administrative officer. And so that process will, I think, lead to a new strategic plan, new goal setting. And there's also a lot of question marks on resources and things like that right now that we're trying to work through. That's a bit limiting, but I'll let anybody else, if you've got anything to respond.
Hi, Sarah. Yeah, we did update our strategic plan about a year ago, year and a half ago. And, but things are moving so quickly in our world. So like Councilmember Cathcart said, we have, you know, a different federal administration from when we completed the plan. We have a state budget challenge and local budget challenges. We have a lot of things that I think we need to revisit in our plan. So definitely something on the horizon. But we're always working towards, you know, better education, better communication, and always trying to support a healthy workforce. That's always been a priority coming out of the pandemic, is supporting our workforce and hiring and retaining excellent staff here at the health district. So I know that's one of the core pillars.
Great, thank you.
Any other questions for us, Sarah?
No, I think that's it.
Well, very good. Well, thank you so much for your time and application. And somebody will get back to you shortly to let you know what next steps may be.
Great, thank you so much. And thanks for letting me have the opportunity to talk with all of you today.
Absolutely. Thank you.
Bye-bye.
Okay. So we're a little ahead of schedule. Is our next individual online?
That individual is not online yet, and
Okay.
I have messaged that person.
Okay. Well, we'll hit pause for a couple of moments until they're up, and then we will move forward. We're good. And if you let her in. Okay, well, welcome back, folks. Apologies on the, we'll pause there, but we had some time in between interviews. Looks like we've got our next interviewee up and in the system here, Stephanie Courtney, and it's also the community stakeholder category. Stephanie, can you hear us okay?
Yes, how are you?
Very good. Good. So Stephanie, we've got board members both virtually as well as in person here. And those of us who are here in person have just a series of questions that we'll go through. There's 6 of them. And so we will start that off with Commissioner Kearns asking the first question.
Awesome.
Hello, Stephanie. How do you define public health? Why do you believe it is important to our community? And what is your understanding of SRHD programs and their role in the community?
I took some notes here, so I'm going to be looking off to the side here. My little one is 6, so I had to go pick them up. And so I will have a couple of notes here I wanted to make sure that I say as I answer this question. So I define public health as a collective responsibility. I have been the executive director at the Shades of Motherhood Network for over 4 years now. And one of the things that we talk about most is community health has to be the center. It has to be a part of the decisions. It has to be a part of the voice. And most importantly, it has to be a part of the solutions. When I think about the responsibility that the Spokane Regional Health District has, they provide the essential services that include communicable diseases, immunizations, environmental health inspections, child health programs. It really plays a huge role in how our community sees health and how people are able to get connected to resources and services. Public health is not only critical to our community, but because Spokane is really facing so many critical issues such as mental health services, the fentanyl crisis. We are a maternal health desert. And most importantly, housing instability. All of these things play a huge key to finding solutions in our community where people can not only be seen, heard, but most importantly, supported through the different health positions.
Thank you. We'll go to Commissioner Jordan with the next question.
Hi there. Question number 2 is what expertise and life experiences do you bring to the board that will be beneficial to representing our community?
I think one of the things that I'll be able to really bring is the perspective of the Black community. I know that there has been a conversation around the health district and their partnership with Black and Brown communities. My organization has served many people in our community in a ton of different capacities, such as doula services, mental health services, and understanding what culturally competent care looks like. What does it look like to partner with community and get them to the resources that not only see them, hear them, but it really embrace the essence of who they are. I always let people think about what does culture mean and how does it play a part in our healthcare community, and grassroots organizations are a big part of that solution. We can lean into our public health sector, but without grassroots organizations being those trusted messengers and helping people get to the right resources, there's a huge gap. And also, too, it puts a huge burden on the different healthcare systems that are doing great work in our community. I not only bring my own personal experience as a Black woman and doing tons of work with grassroots organizations that are Black and Brown, but I consider myself as a trusted messenger in our community across all spaces when it comes to how can we hear people and hear their voices in a different way, and how can we actually start talking about a healthcare community versus a healthcare system. That is a very different perspective to think about. I lived in New Jersey for a long time, and when 9/11 hit, healthcare community became a really big spot for me to really think about, and really asking ourselves, do we know what we know in our community, and how will we come together if there was something that took place, and do we have the right people in our spaces to help address those different crises that might take place. My organization also has been held as a trusted organization, helping people get their voices out and heard, and also helping them find what it means to have bodily autonomy and to be heard.
Thank you very much for that response, Stephanie. And I've got the third question for you. Identify with specificity one significant current public health issue and one future public health issue facing Spokane County, and your thoughts for addressing those issues.
Great question. So I have the first cohort of doulas that not only received Washington State educational training, but we also are one of the first doula organizations that received the Washington State peer support certification that is critical. The reason why I talk about this is because we had over 69 people that came into our mental health program that's ran by a licensed therapist, and not one of them received a mental health referral, and all of them were showing signs of anxiety, depression, psychosis, and for some, they were actually actively attempting suicide. There is not enough behavioral health communities that are diversified. And when we only look at one way of bringing people into a mental health support, it puts a huge weight on really a workforce that is not really built here in Spokane, or we have limited people that have certain background experiences that can be relatable for those that need support, specifically within mental health. And so our goal is to help people to get free mental health services, but we do that through doula services. We do that through trusted messengers, building those relationships and connections. When we have those connections and we're talking about culture, no matter where you come from, we are able to break people into a space where they would never consider, or they weren't ready for that type of mental health community. We have created the Health and Wellness District that is in the Northtown Mall, and there are 3 spaces where over 50 partners have come together to address different things around mental health. We have to really center that, because when people don't have good mental health, it doesn't matter what you say, it doesn't matter what you do, it doesn't matter what you're offering, they're not going to accept it, because there is a sense of mistrust in that space. I also think that in the future, Spokane County is not talking enough about the workforce development around different types of healthcare. And the reason why I say this is because doulas are one of the newest Medicaid approved spaces. Doulas get paid up to $3,000 or $3,500 per person that they provide care to. Doulas provide emotional and physical support to someone. That includes single dads, that includes mothers, that includes people who are in adoption. There are so many different spectrums, and what we have learned is that because we are a maternal health desert, which means there are about 500,000 people, there's only about 40 doulas that are in our community. More than half of them are not active when we did our last study. I think that number has changed now because of the amount of work that we have done. But without these maternal health resources, people are not going to want to have children, they're going to feel alone. They're going to feel all of the different pressures that when it comes to parenthood. That leads to different mental health crises, that leads to different socioeconomic issues. We have to address the maternal health crisis that is taking place. Black women have one of the highest death rates, as well as our Indigenous community. And we are not talking about how to solve these problems enough in our community. Also, we're a college town that can't retain college students. How is that? We have all of these brilliant minds coming to Spokane to learn, and we are not asking the question is how do we retain these students? How do we retain these individuals? And so when it comes to what do we need to really work on, it's the workforce development around mental health, but also increasing the amount of trusted messengers to help people get the support needed that doctors and nurses can't give outside the hospital, and sometimes even within the hospital, they are on limited time.
Okay, thank you so very much. Commissioner Brooks.
Thank you, Stephanie. So my question is, describe your experience on a board or committee and how you handle decision-making when faced with differing viewpoints from fellow board members.
Great question. I think it's so important for us to have a diverse group of people. It does not matter. For me, it does not matter where a person comes from when they're speaking from their lived experience. It's something that we need to listen to, and we've got to figure this out together. There is no me without you, and there's no you without me. And that means that we're going to come from very diverse perspectives. And I think the first thing that we need to ask is, do we all have the same goal? If we are all have the same goal, which is to make Spokane a better place, make Spokane a healthier place, make Spokane more health educated, empowering space, absolutely, we're on the same. We're going to be on the same page with that. When I'm faced with disagreements with others, I'd like to ask the question, why? What makes you think about this perspective? And then I think it gives us an opportunity to say, hey, how do we bring in all of the conversations that will best fit not only our budget, but also our community? Sometimes there are things that we have to wait a little bit longer for because of funds, or we might have to adjust certain things because of situations. And so every situation is going to be different. Every situation is going to need a different view point. But I think it's important as we work together as a board that we listen to each other and we consider what lived experience looks like, what grassroots communities can offer, and how can we really repair and empower each other to do amazing work in our community as well as on the board. It's important for us to actively listen, ground each decision in the data, in the mission, like I said before, and just make sure that we find a common ground. As much as I want to say there's like a perfect way to run a board, I don't think there is. But I think with active people who care and want to listen to one another, we can do great things.
Okay, Commissioner Waldron.
Stephanie, the Board of Health meets monthly for 2 hours, sometimes a little longer. And there's also committee work that can take 2 to 4 hours per month. Do you have the time and flexibility to take on this responsibility in a consistent and prepared manner?
I do.
All right.
Okay, short and sweet, perfect. Well, those are the prepared questions, but the last is simply, do you have any questions that any of us can answer for you?
No, I'm glad to be able to be here with you all today. And I know a lot of the work that you all do individually, and you're people that are really respected in the community and definitely respect the work that you guys are doing. So I don't have any questions. I kind of have been following a little bit on some of the things that you all have been, the health district has been following, and I'm on the same path of trying to figure out what can we do to make a difference and change. And so, yeah.
Thank you so very much for your participation and application. Somebody will be getting back soon with what next steps may look like. And we just appreciate your being here. Thank you.
Thank you so much. Have a great day, everybody.
You as well.
Bye-bye.
Okay, well, right now we've got a scheduled break. We could take Patricia if there was interest in doing so right now, because she is on. Unless there's an issue with that, Michelle, you tell me if I'm incorrect on that. But otherwise, we have a scheduled break, and then we have 2 remaining following that break. Any feedback from anybody? What you'd like to do?
I love it.
I'm willing to go ahead unless you guys feel like you need the break, but in the interest of time, I'm willing to go ahead.
Well, we have to, regardless, we'll have to wait. So Commissioner Jordan, if you,
Either way, but
okay. Thoughts from anybody else? Would you like to proceed with Patricia or take our break now and come back?
Proceed. Would we just take the break after Patricia's then?
Yeah.
Okay, I'm fine either way.
that's fine. Yeah.
Okay.
Okay.
All right. Well, then why don't we proceed? So Patricia, thank you so very much. We, as you know what the process is. So we'll have Commissioner Kearns kick it off with the first question to you.
Hello, Patricia. The question is, how do you define public health? Why do you believe it is important to our community? And what is your understanding of SRHD programs and their role in the community?
Thank you. I define public health by obviously the SRHD definition, which is informed by the RCW. The SRHD definition is a little bit longer, but the RCW definition says public health means activities that society does collectively to assure the conditions in which people can be healthy. This includes organized community efforts to prevent, identify, preempt, and counter threats to public health. I personally like a little shortened definition that I found, which said, we mitigate risks for infection, illness, and death. Communicate information, permits. So it's basically the well-being of the general public or the public at large, and we are a repository for health information for people. As far as how I think that is important, I think that the definition sort of speaks for itself. Clearly, it affects all of us, and so I think that's self-explanatory. As far as the role that the health district has with the community, we have a Board of Health, which is a governance body over the health district with an administrative officer and then a health officer. And then we have divisions below them, and those divisions are divided up based on community health, treatment services, environmental public health, finance, administration, human resources, public information and government affairs, health officer, and disease prevention and response. So I got this little org chart when I went to the last interview, and I really enjoyed looking through it because it has a key, and it goes through every staff member at the health district, and it really helps you conceptualize that this is a body made up of people doing this work.
Thank you for that.
That answer your question?
Response. We'll go to Commissioner Jordan.
Thank you. Question number 2 is, what expertise and life experiences do you bring to the board that will be beneficial to representing our community?
Okay, so first of all, I'm a present board member, so I think that most of you have had experience with me. All of you have had experience with me as a board member. I tried to divide my past experience into past and present things. So I'm educated. I have 2 social sciences degrees and a communication and journalism degree from the University of Southern California. And those things launched me into my interest in neurodegeneration and HIV and AIDS. So I have really pursued both of those things professionally at different times. I also have a post-secondary education in chemistry, and I worked in the chemistry department at Spokane Falls Community College for 5 years. So I think that that my experience as a professional working in the community is informed by my education. And then I want to talk a little bit about the present activities that I do. I've worked in nonprofit and governance work for the past 30 years. So it's been a lot of things that I've done, and I've been in a lot of focus groups and strategic planning committees and hiring committees for executive directors and all kinds of things like that. But presently, I think that as a community representative, some of the things that are really important to me in this position are personal. I've been on WIC, I've been on SNAP, I've interfaced with all of the health systems, whether they're public health, state medical, or through a higher quality, quote unquote, healthcare. And so I've seen and experienced the stigmas and the prejudices that are present in those systems, and I'm very sensitive about them. Presently, I'm the chair of the Affordable Housing and Real Estate Portfolio Committee for the City of Spokane, and I've been doing that for 10 years. And I review with our committee all of the HUD applications that come into the City of Spokane for anything that's related to social services applications, affordable housing applications, all of the grants for that. And it has, having read probably nearing 100 different applications from these organizations, has opened my eyes to what the really specific and detailed problems that these entities face when trying to deliver public health to our city and our county. So that, I think that is an important part of my participation in the community. I have a background writing policies and procedures with the Assistant Attorney General. I did that for 7 years as a trustee for the state. So I understand the state laws and the federal laws and things that are critical to this position. So I think that's probably a pretty good answer to that question.
All right. Thank you, Patricia. Question number 3. Identify with specificity one significant current public health issue and one future public health issue facing Spokane County, and your thoughts for addressing those issues.
Okay, I really like this question, and it took me a while to think about a good answer for it. The first thing is, for me, presently would be the mental health crisis and chronic disease burden, which includes the fentanyl crisis. I noted on here that 1 in 5 people worldwide are dealing with a mental health condition, and it's the leading cause of disability and associated risks of non-communicable diseases like heart disease, cancer, and diabetes, compounded by widespread social isolation and substance abuse. So I think for me, that is a present issue. And then future issue would be infectious disease outbreaks and pandemic preparedness and health system fragmentation. And I really focused a lot on the idea of health system fragmentation. And I made a note here about how care is spread across many disconnected providers and organizations, lacking coordination, communication, and a unified patient view, leading to gaps, inefficiencies, duplicated tests, and poor patient experiences, especially for those with complex conditions. And so those are the two. How to address them: prevention, early intervention, integrated community-based care, reducing stigma, improving access, especially via telehealth and parity laws, training first responders, addressing social determinants of health, using better data for better outcomes, building resilient social connections. That's how I see how to address those things.
Okay, Commissioner Brooks.
Thank you, Patricia. So can you describe, your experience on a board or committee and how you handle decision-making when faced with differing viewpoints from fellow board members?
Yes. Of course, listening is important, and I think if you've made it to a board position, you probably are aware of that. I observe the rules, so I pay attention to Robert's Rules of Order. I pay attention to the bylaws. I pay attention to our strategic plan and what our goals are. But then further than that, I try to take initiative and I try to fill gaps where I recognize them. So if I feel that somebody else can equally do or participate in something, I try to give space for that to occur. And then if I feel like I'm recognizing a gap that no one is stepping up to address, I try to take initiative and address those things. So I try to get involved, and I try to communicate well and listen, and I try to be open and speak openly, but not be too opinionated.
Okay, last question.
And that seems to help.
Commissioner Waldron?
Hi, Patricia. The Board of Health meets monthly for 2 hours and sometimes more, as you know. And there's also committee work that can take 2 to 4 hours per month. Do you have the time and flexibility to take on this responsibility in a consistent and prepared manner?
I do, and I think my participation on the board speaks to that. I missed one meeting in the 2 years that I was here, and I also attended a lot of extra activities. I attended meetings with the union and community stakeholders. I've toured treatment services. I've gone to many different conventions. And so, yes, I have the time and would continue to be dedicated and hopefully thorough in my role.
Patricia, do you have any questions for us?
Well, since we had these scheduled for a week ago and we didn't get to it, I had a question written down, which was who was going to win the Super Bowl, but I think we got our answer to that. So I don't really have any questions. Yeah.
All right. Well, thank you so much, Patricia. Appreciate that. And just for folks that don't know, I maybe wasn't clear enough at the beginning of this interview. Patricia Keenholz, and the category is Consumer of Public Health. We had originally 2 applicants to be interviewed. One of them had dropped out last week. And so Patricia is the only person that we'll be interviewing for this category. With that, is there any news on any modification to timing?
I called and texted, and there has been no response.
So our next interview is scheduled for 3:05, so we've got a little bit of time here. And so I just propose we hit pause and maybe try to come back about 2:55 and see if perhaps our last interviewee is able to come on a couple minutes early. Okay. All right. Well, with that then, I guess we will hit pause and see folks back here in 20 minutes. Well, welcome back, everybody. It is 2:57. Apologies on taking an extra 2 minutes there. But it does look like we've got Dr. Blakowski May in the lobby here, so we will bring her in. Dr. Blakowski May, are you there? Can you hear us?
I can hear you. Can you hear me?
Yes, we've got you. Thank you very much. Appreciate you being able to make the time. Okay, and as we've done with all the other candidates, we've got 6 questions, and we will go around the room here and pose those questions to you. And we'll kick that off first with Commissioner Kearns.
Hello, Dr. May. How do you define public health? Why do you believe it is important to our community? And what is your understanding of SRHD programs and their role in the community?
Awesome. Well, thanks for that question. So I've been a family doc for many years, as you guys know, and I see the public health as being kind of an extension or expansion of what we do on an individual basis with patients in our offices. And it's an opportunity to really be able to look at communities and populations, which certainly is made up of those individuals, and affords just a broader perspective and opportunity to study and influence so that the overall health and wellness of our community is improved. Public health promotion, generally, I just really have a soft spot for it. It's incredibly important. We've seen with COVID recently how critical it was, but also the resurgence of some of our infectious diseases like measles, related to maybe inadequate vaccination recommendations, adherence. And being on this Board of Health, actually, these last 2 years, I've certainly learned a lot more in depth about what the Board of Health does in our community, besides just programs promoting vaccination, but including like the food policies and environmental monitoring, and particularly the opioid treatment program, which I think is so super valued in our city and county, and as we struggle with certainly high levels of substance abuse. So I think that Spokane Regional is really an important leader in our community to promote public health through educating the community and certainly collaborating with other partners and institutions in our area to support our overall wellness. I've also been particularly excited to see the recent addition of our tribal members on the health board.
Very good. Thank you, Dr. Blakowski May. And Commissioner Jordan has the second question for you.
Okay, number 2 is what expertise and life experiences do you bring to the board that will be beneficial to representing our community?
Sure. So as you guys know, primary care provider in this community for a long time. And as such, that really gives me a good understanding of prevention topics, but also population health and the effects of health disparities, health equity issues in our community. Also bring knowledge of healthcare operations and business practices from a career as a healthcare executive and an MBA training. And then do have a lot of experience too with governance, policies and risk, most recently, and specifically with this particular Board of Health.
Great. Thank you so much. And I've got number 3 for you. Identify with specificity one significant current public health issue and one future public health issue facing Spokane County, and your thoughts for addressing those issues.
Yeah, super important question. I think, something that we've been talking about on the board, and certainly have a lot of concerns about is the threat of defunding our public health programming due to the federal government's abrupt withdrawal of support. I think that's very concerning, and appreciate all this board's activity on advocating for public health at both the state and federal levels this year. So that's super concerning. I think other things like changing questionable, sketchy changes to the immunization protocols that are milling about really puts our kids and vulnerable elderly folks especially at risk to infectious disease, but undermines fundamentally trust in the healthcare system. And that's super concerning. In the future, I think probably the biggest concern is what I see as the contraction of Medicaid funding. I think that that's going to be a huge problem, and with surging costs of health insurance, it's likely going to really have a devastating effect on access for our community members. And I worry that any progress we've made on chronic disease care and prevention will just be eroded, and the socioeconomic disparities will be aggravated. And I think that, through those advocacy activities that I referred to before, and, further development and investment in our programs to partner with our community, I think that's what we need to do. But I have a lot of concerns.
Okay, thank you for that. Commissioner Brooks.
Thank you, Dr. Blakowski-May. Could you describe your experience on a board or committee and how you've handled decision-making when faced with differing viewpoints from fellow board members?
Yeah, great question. So I have enjoyed serving on multiple boards and committees over my time, including the last 2 years on the Board of Health. In my experience, fellow board members, have always shared an interest in the success of the institution or the people that are being represented by that board. So I think that's really important to keep in mind. Otherwise, those board members wouldn't bother serving if they didn't care. So keeping that in mind really, I think, helps it make it easier to be respectful of people's different opinions. I also think it's helpful to recognize how rewarding it is to really be a part of a group that is, has a shared understanding of the institution's mission and, what we're trying to do for the community. And that just helps just a feeling of, teamwork. You're out for the same good of the community, and it just makes it so that it really isn't about personally ensuring that your own opinion carries the day, but really being curious and about different perspectives people can bring from their background. I think that really helps to smooth over conflict.
Okay, and Commissioner Waldron with our last prepared question.
Thank you, Dr. Blakowski-May. The Board of Health, as you know, meets monthly for 2, sometimes more hours. And there's also committee work that can take 2 to 4 hours per month. Do you have the time and flexibility to take on this responsibility in a consistent and prepared manner?
Yeah, I mean, lately the Board of Health has been extremely busy, I think, but that hasn't really been the case for the whole term. So that's a good thing. And I really think that once we get through the leadership changes and that stabilizes with a new AO, that will likely return to the more typical time commitment. But I'm really grateful that my role at the VA has kind of allowed me to be flexible with my time to be able to participate in these meetings and and certainly always try to be prepared for the meetings in advance. But also particularly want to give a little shout out to the rest of the board members and the team and the staff that has always, worked with me to help me be able to participate and accommodate my time needs. So I really appreciate that. So thanks.
Yeah, thank you so very much. Our last question is simply, do you have any questions for us?
Sure. I have one question I'll throw out there for the panel. Basically, how would you like to see the Board of Health function improve or evolve over the next term?
Anybody want to tackle that? Yeah, go ahead.
I mean, I think you stated that we have the new AO. So I think until we get the new AO, there's a little bit of figuring things out as we go. So I mean, I think to me that's will help determine the calmness that will come over, I think, the board. And and as you know, we've made changes here lately and added new board members. So so it'll be important to get that new AO on. But otherwise, I mean, I think it's the same that we've been doing. It's like really guiding and helping.
I would agree. Anybody else with an answer on that? No? Any other questions for us, Dr. Blakowski-May?
No, I think that's good. Thank you all.
All right. Thank you so very much. Appreciate your time. Okay, with that, we have completed the interviews, and my understanding is that we will now move into potential motions to approve recommendations to the Spokane County Board of Commissioners on each of these citizen appointee categories. And so again, the different categories include...
Should I drop off? I feel like I should. I feel like I'm supposed to drop off.
Unless you want to be part of the discussions for categories you're not in.
Yeah,
but you
I guess
didn't listen to any of those, so
correct.
You probably should drop off.
Fantastic. Have a great afternoon. We'll talk to you later. Thanks.
Perfect. Thank you. So again, we will now move into a little bit of discussion on each of these categories, which include public health, healthcare representative is 1, community stakeholder is 2, and consumer of public health is 3. And the consumer of public health is the first item on our agenda. So I would entertain a motion, if anybody has one, for 3A. Consumer of public health.
Yes. So I'll make the motion as we have one candidate. So this will be the easy one, to appoint Patricia Keenholz as the consumer of public health for the appointee.
Great. Is there a second?
I'll second the motion.
Second.
All right. Well, we've got a motion. I think we got a couple of seconds. A couple of seconds. I don't know if it's that Maureen. Okay. Very good.
Yes, that was Maureen.
Is there any discussion on this motion? I am seeing none. So all in favor of recommending Patricia Keenholz to be the representative for consumers of public health, please say aye.
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 Any opposed? Abstaining? Okay, that is dispensed with.
I guess I
just
abstained.
I was just going to clarify that, make sure we note that Patricia abstained.
I'm an abstention.
Oh, yeah, thank you, Patricia, for clarifying that. That is helpful. Yeah, and she can't participate in the others. Okay, so we are now on 3B, which is the recommendation for a representative of public health, healthcare facilities, and providers. So with that, I would entertain a motion. Commissioner Waldron, Commissioner Waldron.
Thank you, Mr. Chair. I would motion that we recommend Dr. Blakowski-May to remain the public health, healthcare facility and provider representative on the Spokane Regional Health District Board of Health.
Great.
I'll second the
Second.
motion.
Got lots of seconds. Good things. Is there any discussion on this motion? I'm seeing.
I just wanted to.
Yeah, please.
I just wanted to thank those who did apply. We actually had some excellent candidates, and Dr. LaSalle is obviously highly qualified. And congratulations to her on getting her master's in public health. And I hope she'll continue to be engaged with the health district and all the good work she does to support our community.
Any other comments? Seeing none, okay. All those in favor of recommending Dr. Blakowski-May to be the representative of public health, healthcare facilities, and providers, please say aye.
Aye.
Any opposed?
Aye.
Any abstaining? Okay, that is completed. And that leaves one last recommendation to the Board of County Commissioners, which is to choose the community stakeholder representative. And so I would look for a motion.
Mr. Chair, I would move that we select the candidate for recommendation to the Spokane Board of County Commissioners to represent community stakeholders on the Spokane Regional District Board of Health, Derek Baziotis.
Okay, got a motion. Is there a second for the motion?
I'll second.
Okay, we've got a motion and a second. Commissioner Jordan.
Mr. Chair, if I could, I'd like to make a motion to amend the motion
Okay.
to recommend Stephanie Courtney for appointment for this position.
I'll second that.
All right. There's a motion to amend the base motion, replacing the name of the individual selected. Is there any discussion on the motion to amend? Go ahead.
Yeah, I thank you, Mr. Chair. I just wanted to recommend Ms. Courtney for the position. I guess recommend to the board. I think her experience as the executive director of Shades of Motherhood Network was very strong. I liked that she articulated an understanding about the importance of partnering with grassroots organizations to improve public health. She talked about having an understanding of peer support, the role that plays, navigating people to the right services to help them improve their health, supporting mothers and fathers. I just thought she brought a really good perspective there. I think it's important that her organization, Shades of Motherhood, works closely with families in the Black community in Spokane County. I was just doing a little looking during the meeting that if you look at SpokaneTrends.org, life expectancy in the Black community in Spokane County is quite significantly below the overall county average. We know that the CDC has reported significant disparities in terms of infant mortality as it relates to the Black community. And I think that Ms. Courtney brings a lot of direct experience there. She's really focused, passionate, and able as it relates to understanding health and well-being for kids and families. And I just think that focus on families and kids is foundational for public health, and just appreciate her as a leader and would recommend her.
Okay. Do we have any further comments on the motion to amend? Commissioner Waldron.
Thank you, Mr. Chair. I would support Commissioner Jordan's motion, and it's very challenging because we had 3 candidates that were actually really excellent, well-spoken, and they all are very passionate in the different areas that they work in the community. I did have Ms. Courtney as my first choice, and I was impressed with her work with maternal child health. I think there's a strong connection to the work that the health district does to impact disparities around maternal child health. And anyway, I think that she would add an interesting new perspective and voice to the board, so I'll support the motion.
Okay. I'm not seeing any other hands up for the moment, but I will just offer my own quick thought here. I I am inclined to vote against both motions. I was blown away, absolutely blown away by what we heard from Sarah Spear. And I think we talk a lot about lived experience. We talk a lot about fentanyl, talk a lot about addiction. And I just don't think anybody could bring stronger perspectives on those than that candidate there. So I'll just leave that there. Is there any other comments on the motion to amend? Seeing none, all in favor of the motion to substitute Stephanie Courtney for Derek Vaziotis in action item 3C, representative for community stakeholders, please say aye.
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 And those opposed, nay?
Nay.
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 Okay. Abstaining? Okay, does somebody have a,
Chair, I was going to ask for a roll call vote.
yeah, can we do, yeah, that'd be great. If we could do a roll call. So why don't we start with the folks online? Liz Henry,
Yes, I support Stephanie Courtney.
okay. Maureen,
I support Stephanie Courtney as well.
Patricia Keenholz,
I was a nay.
okay. Commissioner Kearns,
Nay.
Commissioner Jordan,
Aye.
Commissioner Brooks,
Nay.
Commissioner Waldriff,
Aye.
and chair is a nay. Sure. So, can you restate that? 4 nays?
We can't hear what's being
Okay.
said.
Yep, we're just, thank you. Ann was just tallying that up. So it looks like it is a 4-4 is the vote on that, which means I guess the base motion remains. And so with that, is there any further motions?
I would amend the motion to support Sarah, is it Spire or Spear? I
I've
apologize.
said Spear, and I hope I wasn't getting that incorrect.
Sarah Spear, she was my second candidate, and so that I'll put that motion to amend the underlying motion.
Okay, is there a second?
Can I ask a question?
Yeah, I guess, go ahead, Maureen.
I guess I'm a little confused. So if it's tied 4-4, then what does that mean, that we can't vote for her? We can't go with Stephanie anymore?
It means simply that the motion failed. And so the base motion is still on the table, essentially, to appoint Derek Vaziotis.
Okay.
Okay, I understand now.
All right. Well, you know what? I'm going to retract my motion then, because maybe
I
we just need to-
seconded the
Maybe we
motion.
just need to vote on the underlying
Okay,
motion.
we can do that.
Because I don't know if we're going to come to an agreement, so I'm just going to retract my motion.
Okay. With that, the motion is still on the table. Is there any comments related to the motion?
I'll speak to it. So I nominated Derek mainly because I was viewing this as at least in my time on the board, would be the first time we've had the opportunity to have another board member who represents people that directly deal with a health district department. I mean, when it comes to the food safety, when it comes to those food handlers, permits, I mean, that's one of I think our busiest departments. I mean, they're out there daily going restaurant to restaurant, checking to make sure that food safety standards are met. When you think of the thousands and thousands of individuals that work in those restaurants, they have to get food handlers permits from the health district. I don't think there's any other option. Like, it's the health district is where they get them. So that's really what I was impressed with, was it's somebody who represents folks whose livelihood is directly related to the operations of what the health district provides. So That's what I was impressed with, because in my 10 years on this board, we've never had that.
Commissioner Brooks?
Yeah, so I mean, I have been on different boards with Derek, or I've been on a board where we've reached out to him and he's been very helpful and very passionate about doing what's right for the community. But I will say I'm with Councilmember Cathcart that I thought Sarah did a really great job, and she is my number one choice. And I think as everyone talked about what is our current and future topics and issues, fentanyl was like number one on everyone's list. And so as much as I like Derek, I think I'm going to be voting no and supporting Sarah.
Thanks, Commissioner. Any other comments? Oh, Michelle, do you have a?
Yes, I just wanted to make sure that it got captured that Patricia Keenholz had seconded Amber's motion. So procedurally, I want to make sure that doesn't get lost, and that may be why Patricia's hand is up too.
I apologize. I did not hear the second. I guess, is that, Michelle, is that still valid if it wasn't recognized?
It's hard when you're doing a hybrid meeting like this, but I know, Anne, did you hear the second?
I did not hear the second. And then Commissioner Waldruff retracted her motion. And I don't know if that was based on no second or not.
I thought that Amber retracted because she didn't hear the second. I did say it twice, but I wasn't sure if that was why she removed the motion, because she hadn't heard a second.
Yeah. Thank you, Patricia. I nothing would preclude somebody else from making another motion, but I did not hear it at the time and didn't recognize it. And so unless Michelle tells me otherwise, I would just move forward, assuming that there is no motion to amend at this point. But if there's other comments.
Yeah, if it wasn't recognized, then, but like you said, somebody else can make the motion now.
Liz has her hand up.
Or we can vote. Exactly. Yep. Yep. And so
yeah,
your hand up.
felt like his scope was very narrow. I felt like the other two candidates had a much broader perspective, and that narrow focus on just the restaurants and food handlers didn't serve us as well as some of the other candidates who had, especially Stephanie, who had a breadth of knowledge in the public health.
Thank you for that. I don't see any other hands. I will just simply offer, I think Derek would be great on the board because he does bring such a interesting perspective that we have not had on this board previously, as far as I know, previously. I think that industry is, highly regulated by SRHD and would make a lot of sense to get those perspectives. That being said, I do believe that with the issue of addiction and fentanyl and mental health, just being pervasive across our community, and as Commissioner Brooks said, an issue that is, not just now, but well into our future that we're going to be dealing with. I think her firsthand experiences, as well as her professional and just civic engagement on these types of issues, would be extraordinarily beneficial to this board. And so I don't suggest that I'd be voting no because of anything other than I just think that is an issue that really, truly deserves some really, really strong representation at this point in time. So with that, we'll go to a vote. Oh, Patricia, go ahead.
I was just wondering if I can amend the motion to.
If you would like to make a motion, yes, go right ahead.
For Sarah Spear.
If there's no second, we will just take this vote and then we will entertain a second motion. I am not seeing a second at this time. So with that, let's go to the vote on the motion to appoint or to recommend Derek. And so all in favor of that motion, please say aye.
Aye.
Any opposed, say nay.
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 And any abstaining? Okay, So that motion fails, does not secure an adequate number of votes. So with that, I will entertain another motion to recommend an alternative candidate. Commissioner?
So I will make a motion to appoint Sarah Spear, I apologize, as our community stakeholder.
Is there a second?
Second.
Thank you, Patricia. So we have a motion and a second. Is there further discussion on the motion to recommend Sarah Spear?
I have a question.
Wait. Sorry. Hang on.
Yes, please, Maureen.
Can you give me 1 second, just 1 second to collect my thoughts as I was thinking about this? Just 1 second.
Can I have Commissioner Jordan go and then we'll come right back to you?
Absolutely.
Okay.
I guess this is like a point of parliamentary inquiry or a question for the attorney, but if the board was to not have any of the motions passed, what happens then?
Great question. Do you have a thought on that, Michelle?
Yeah, I'm not so sure that it's parliamentary procedure, but if the board can't agree on a candidate, then I think we'd have to do some more interviews and bring some more people in.
Michelle, would the Board of County Commissioners be free to select from the applicants, or at least those who were interviewed in that instance?
No. The WAC is clear that the interviews and the recommendation happen at the Board of Health, and then the appointment happens at the county commissioners.
Okay.
Or not, as you guys decide, but.
Right. Okay, well, with that, Maureen, if you have
Yeah.
a comment?
My comment is mostly about still, I mean, I think Stephanie did interview very well, as did Stephanie. My problem is that as a Native woman and knowing that we are always the winner in the loser categories, especially in public health, and so is the African American community. And so it's like, I feel like we need to work on those type of issues. I know fentanyl. Everybody knows fentanyl's out there. Everybody knows I'm dealing with it every day. That's what I do. I'm in the behavioral health. I got kids over here with it. But I mean, these are underrepresented groups usually, and I have a passion for that. And I'm just frustrated not frustrated. I'm just like, I mean, can't you see this is more about like I can't get my words right now, but it's frustrating me to hear, just because, I mean, I've been living this my whole entire life. I know that I'm not going to live as long as you guys because I'm Native, and Black communities are just as well. So I feel like that's a big public health issue. And so that's where I'm coming from. I'm a little frustrated because I know fentanyl I know all these other things too, but it's like, as a community, as an underrepresented group, I feel like a whole section of people need to be have their voices heard here in this realm.
Thank you, Maureen. Commissioner Jordan.
Further question for Michelle. If this board did not advance a recommendation on this particular seat, would it be your expectation that the commissioners, where does that leave us with who the Board of Health is to make the recommendation going forward, given the terms of some of the other members?
So going forward, there would be 9 members on the board. There would be the community stakeholder position would be empty going forward. And so then there would be 9 folks taking a vote after additional applications, interviews, etc. So a recommendation could be made.
I guess my question would be, can we double check the resolutions that the commissioners passed approving the 3 community positions? Because I think they had a deadline on them, and I think that was tomorrow, if my memory's not mistaken, or maybe today. Yeah.
I don't remember specifically what the day is, and Ann might know.
I'm almost certain the copies of the resolutions that you sent out a couple weeks ago said our current 3 appointed members, they are through the 12th, which is today. I'm almost positive that's what the resolution said.
That is
Okay.
what it says.
So then I want to make sure I understand the question. Is the board saying they want to take a vote later, before the two that are going to be recommended for today are appointed?
If I'm
So that
hearing
there would
correctly-
only be 6 on the board?
Yeah, I think if I'm hearing correctly, that's the question is, if we do decline to recommend in this position today, who would then subsequently make that decision of who we recommend?
And that would depend on when that decision is made. If it is made Friday before the recommended people in the other two categories are formally appointed by the Board of County Commissioners, then you would have the 6 people.
And then, since we have allowed for Dr. Bykowski-May, since she was not part of the interviews, as we discussed ahead of time, she would not be part of the vote for this position.
Right, and keeping in mind our time frame is before the Board of County Commissioners has reappointed her, so she would not vote in that situation. If it is the time frame that the Board of County Commissioners has reappointed her, then she wouldn't vote because she wasn't part of all of the interviews today. So she doesn't have the background to be able to hear the people's answers.
Liz, go ahead.
I have 2 questions. First, I don't know all the procedures, but does the chair vote only in the event of a tie, or do they vote on every recommendation?
On this board, the chair votes.
Okay. And my second comment was that I agree with Maureen. I think that Stephanie's child and maternal health experience is very a very important issue. I also agree that, fentanyl, there's a huge task force for fentanyl that lots of people, we have a treatment center, you have a treatment center. I don't think that is the not hottest topic, but most important topic. I think that as she said, there is a desert for maternal and child health in this area. And I think that's something that we really need to be concerned with, especially for the Black and brown community.
Okay. Are there any other comments? Commissioner Jordan? Oh, okay. Not Commissioner Jordan. Commissioner Waldron?
No, I just appreciated that's why I withdrew my motion, was just I wanted us to just talk about this more and look at all again, as I said earlier, there was strengths of each candidate. I think some bring, like Stephanie Courtney, some new and lived experience that would be important to have, that I haven't seen on this board for many years from my previous serving on the Board of Health years back. So those are just my comments. But again, 3 excellent candidates, so this is what we get.
No, thank you. I will just very briefly say, with regards to Stephanie's interview, certainly very impressive. I think that the emphasis that she brings is important. My wife and I, we just had our second kid, and there's a lot that goes into that, and healthcare around maternity healthcare is pretty important. I would just say, from my vantage as a council member in the city of Spokane and dealing with the things that we do on a daily in and out basis, the issue of fentanyl, just to me, in my experience, rises just about above anything else. And I think, Stephanie would have a lot to contribute, but I just think the fentanyl issue, for me, rises to such a substantial level. So that's sort of the reasoning behind how I'm viewing this. Commissioner Jordan, did you have some?
I just wanted to just thank all the applicants for applying. I think they all bring, we're trying to figure out what to do with some strong applications. They all have unique skills. I think they all have unique backgrounds. And like other board members, I have my my first choice, and so I do plan to vote against the motion. Nothing, I wouldn't speak at all against Ms. Spear. I think others have spoken to the strengths that she clearly brings. I just prefer Ms. Courtney and would like to see her application move forward. And so that's why I'll be voting no on this motion.
Okay, Commissioner Kearns.
Yeah, I made it clear in my motion earlier who my first choice was, but certainly willing to compromise here as I look back over my notes on Miss Spear. I think she'll be a great addition. I think she would be a great addition. Someone who is 16 years in recovery and working as a consultant on behavioral health, listed off several pieces of legislation that it sounded like she played a part in Olympia. I think having somebody with lived experience like that would be a great addition to this board, and quite frankly would be an inspiration to all the other folks that are struggling with addiction and are trying to find their way to recovery. So I'll be supporting the motion.
Any other comments before we take a vote? I'm seeing no hands. Okay, so let's proceed to the vote. All of those in favor of recommending Sarah Spear, hopefully I get that right, Sarah Spear as the community stakeholder representative, please say aye.
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 And any opposed, say nay.
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 Okay, I believe that is also a 4-4. Michelle, I would have a question for you. Could we punt this to the county commissioners by making a dual recommendation and allowing them to choose?
Interesting question that I hadn't considered previously, because the WAC doesn't speak to it. So we would be kind of in no man's land, if you will.
And I would oppose that. I think the whole point that Maureen and I were appointed to the board was to expand the perspectives of, different views instead of just continuing with the same perspective going forward.
Well,
Can
Patricia,
I ask, Michelle, can you read the RCW to us?
The RCW or the WAC?
The RCW.
The RCW doesn't really speak to this process.
Is that the one that says that that the interviews are done by the Board of Health?
The WAC talks about that.
Can you read it?
I'm getting it. Okay, this is WAC 24690-0206. All applicants for non-elected positions shall be interviewed in a panel format by the local Board of Health, subject to the following. All applicants shall be asked a standard set of questions, and follow-up questions may be asked if necessary to understand the applicant's response to a standard question. And C, in the event of a substantial number of applicants, the local Board of Health may elect to interview a smaller number of applicants, as long as the applicants interviewed include a diversity of expertise and lived experience. So that's that part. Let me get to the rest of them. Bear with me.
What was the WAC number?
24690-0206.
So Michelle, I think you're right. It does not speak to at all the possibility of a dual recommendation, either favorably or negatively. So I guess maybe a gray area, but if it doesn't speak to it, I assume we could theoretically choose that, understanding the objection that we heard.
I'm going to pull up the rest of that 24690 section. Waiting for my computer to cooperate.
What were the last digits on it? 24690 dash or what?
020.
026.
020.
Oh,
Oh,
020.
okay. Thank you.
You bet.
So it says if a local board of health demonstrates that it attempted to recruit members from all three categories under subsection 1 of this section and was unable to do so, the local board of health may select members only from the other 2 categories.
Right, but we had applicants in each of the categories.
Michelle, what if we just didn't appoint this category? I'm not suggesting that's what we do, but what if we didn't and we just proceeded with the other 2 and move forward? What would happen?
Well, we have to have the right balance, right? So we can't have more electeds than non-electeds, and we would have a vacancy in that spot, which would throw off our balance. So at some point, we're going to have to make you all are going to have to make a recommendation. If we look at 246-90-030,
Okay.
non-elected members shall be approved and appointed by a majority vote of the Board of County Commissioners. But it doesn't talk about anything beyond that. And I could go back and try and find the county's resolution. But as I remember it, it tracked pretty closely to the statute and the WACs.
So the issue is really probably the balance, the makeup between electeds and non-electeds. But assuming if that balance were proper, we could theoretically hold business even without this position.
If we had the balance, or if we don't have the balance?
If we had the balance.
If we had the balance,
Okay.
yes. But with these 3 positions, we're at 10. So if we're missing 1, we're going to be at 9. We'll have 2 tribal, 2 citizen, and
5 elected.
5 elected. So our balance would be off.
Well, yeah, Commissioner.
Did they, with the latest change to the RCW, Michelle, from the previous board makeup, I mean, we went 2.5 years without a tribal member. But did the new RCW did it clarify the balance?
The most current RCW talks specifically about not having more elected members than non-elected members.
Let's equal the number, yeah. Says elected members of the local board of health may not constitute a majority.
Commissioner.
So just to follow up on that, Michelle, does that mean that the fact that we have the positions balanced, is that sufficient, or does it require the actual positions to be filled in a balanced way to have any business proceed?
You have to have the 3 citizen members, 1 from each category, and then allows you to then have your 3 county commissioners. Then we also have the City of Spokane representative, Councilmember Cathcart, which allows for the 4th, and we have the 2 tribal members.
But we have the possibility of another tribal member, don't we?
Absolutely. And if that were to happen, then we could add another elected, potentially.
Can I just ask? Sorry, this RCW, it's just.
So, it's not
the reality is
clearest.
Practically, you could have someone who's an appointed member resign for whatever reason, personal reasons. And then what, you're going to kick somebody off the board and then put somebody back on like within a month? That doesn't make any sense. Like I'm trying to read the RCW for, the letter of the law, but really the spirit is that you're constantly trying to fill positions. You're not constantly, I don't think, taking people on or off. That doesn't make any sense. Like there's always a potential that somebody or an elected official could resign. And it may take a while for that position to be filled. So I'm just throwing out, like, practically, we're trying to make it work in the real world of a board with people coming and going. So I just can't imagine they were thinking that at every moment, every single seat had to be filled, because that's impossible.
Well, that's sort of what happened last year in reverse, right? I mean, I had to step off for a short period of time while we sorted out who would be coming on to make up that balance. And so, but you're right. I mean, I don't think the intent was every minute of every day.
But I think I don't know. I thought we did that really to get in line with the new, like, start with the new law and then move from there. But I don't know if there's any other examples of frustrations with this around the state, but it's just hard to operationalize it.
Well, it also says that a tribal representative may serve in any of the 3 non-elected member categories. So theoretically, Liz or I could be this in this position rather than Sarah or Stephanie, theoretically.
But then I think you'd have to be selected and you wouldn't be in your tribal role.
That's true. And I don't want to do that.
Okay, well, the stalemate continues. Is there a motion or a thought, suggestion from anybody?
I
believe we still have a
one
motion
thought.
on the floor. For
If
Stephanie, didn't we?
as part
Or
of
Sarah.
the
Didn't someone
discussion,
make a motion?
It was 4-4.
It was still the 4.
we have a motion and a second, but we're in discussion, and I just want to clarify, Michelle. So if we were to, we took the vote, right? So we had a 4-4 tie. Is that correct? Right? So
Yes.
So we don't have a motion on the floor. So if we were to decide to allow, could we take a vote to allow the county commissioners? So could I make a motion that the decision be handed to the county commissioners to decide on that candidate or the person that they choose? And then if there is a problem that arises as a result of that, if we were to seek an opinion, I don't know if you go where you go for that, to the attorney general, or who you go to get the opinion about whether we handled that correctly or not. But then we could deal with that later, and at least we would have a person in the position until we had further instruction as to whether what we were doing was legal or not.
I can't tell you that would be legal to do that because it's not addressed as an option anywhere. And then if you run the risk that the county commissioners pick somebody, they are on the board, and then we get an opinion from the AG, and then that person gets kicked off the board. I'm not sure that that's the best way to go about it.
Right. This might not be.
And what is a better way?
Can I have a couple questions?
Commissioner Jordan.
So, compromise and get that and pick somebody.
Go ahead.
How long did we have the meeting scheduled for today?
Till 4:00.
Oh, okay. My question was, I thought it was later. I don't know where I got that information from. But so I blocked out my day. But the question was if Dr. Blykowski-May was available to rewatch the interviews online, could she then vote and break the tie?
I don't think that would be appropriate because we're just doing that to influence the decision. And that doesn't seem right to me.
Yeah, and
well, my
she
intent
didn't have
with the question
the opportunity to ask questions of the candidates, or,
The intent of the question was to ensure full participation from board members.
Well, I mean, the intent, I mean, had we started on the day we meant to start on, I'm sure Dr. Blykowski would have made a vote at the time, but this got changed to another day when people didn't have, it got put on us at the last minute that like, no, everybody has to be here, and then she couldn't be here. So how's that in the world of fairness? How's that okay?
Yeah, Dr. Blakowski couldn't participate the last time either. She had the same restrictions.
She was on the phone, or she was there.
But I asked her, and she was available to do her interview, but she was not available to listen to any other interviews going forward on the day that it was previously scheduled.
Michelle, if there were to be a motion similar to what Patricia suggested, could that happen now with the qualification that perhaps at our board meeting on the 19th, we're gonna have to have a special board meeting on the 19th, that there could be an item there to reconsider that or do something different if in fact it were to turn out to not be proper? I'm just trying to think how we break this stalemate today because there's really not a lot of options.
Unless you defer the decision to the 19th on that one category.
I mean, it wouldn't change the outcome in terms of who would vote on it, though, at that point in time, but we could defer it to that meeting.
Yeah, I think you could defer it to the meeting on the 19th. You'd have a gap of a week there, right? Where 6 days, or maybe longer than that, because the county commissioners then would have to appoint whoever's going to be recommended. So conceptually, if you're inclined, sorry, Patricia, but if you're inclined to make that sort of motion, I would include in it that the board is unable to reach a consensus. And so we're stuck. And then that's why you put two names forward to the county commissioners.
I want to clarify that the WAC actually says that the language is not just that the board does the interviews, but that we actually make the recommendation to the county commissioners.
That I believe is in the RCW, and it's also in the county's resolution.
We have 5 minutes left. Commissioner Kearns, did you have?
Okay, so can we make a recommendation that the two applicants are moved forward for consideration with the ultimate decision being made by the county commissioners?
I can't say that that's going to be lawful, but I would, if you're going to do that, I would include in the motion that it's being done because the Board of Health cannot reach a consensus.
I'm gonna go to Commissioner Kearns here. Patricia, hold on. I'm gonna go to Commissioner Kearns.
Because there seems to be no agreement on the Board of Health on a final single recommended applicant, I will move that we the Board of Health and that we will select the candidates Sarah Spear and Stephanie Courtney to be recommended to the Board of County Commissioners to represent the community stakeholders on the Spokane Regional Health District Board of Health.
Is there a second to that motion?
Wait, can I amend it? Can I amend that motion?
We have to get a second first.
Okay.
Is there a second?
Second.
Okay, thank you, Patricia. Yeah, we have a motion and a second. Go ahead, Maureen.
I guess my amendment would be not to do what Josh Kern says and defer it till the 19th.
Okay, so your motion would be to, it's kind of substantially different from the original motion. Is that okay, Michelle, for that to be an amendment to the motion?
That's not really an amendment. It's really a different motion.
Yeah.
That it be deferred and no decision be made today.
So
okay.
I would say that to do that, you simply have to vote on this motion and then make that motion.
Okay, got it.
And I just want to clarify, did the motion include that that the county commissioners would then decide who's going to be appointed? Did it include that?
That was the intent of the motion, that because we are recommending the two candidates to the Board of County Commissioners that will represent that stakeholder position. So, I mean, my intent, I guess, to clarify it would be that the Board of County Commissioners would then select the one candidate from those two.
Can I also just say as well, before you go on there, that in it says consumers of public health, that it says the special supplement, wait, no, it goes, it strongly encouraged that individuals from historically marginalized and underrepresented communities are given preference. I'm asking that Stephanie Courtney be given preference.
That's a different category.
That's my position.
That's Patricia Keenholz's category. This is the community
Oh,
stakeholders.
sorry.
If I misspoke, did I say community stakeholders?
That's
'Cause
correct.
Okay,
You're
I
correct,
want to make sure
Josh.
that I didn't misspeak.
sorry.
Sorry.
Okay. We still have a motion on the table. Is there any further comments? Commissioner Jordan.
Question for legal. Is there, could a motion be made to send two applicants in a ranked order?
I guess theoretically, but if you have a ranked order, then you would have somebody that you'd pick, because otherwise you're going to have 4-4 as far as ranking.
All right. Well, we've got 2
Presumably.
minutes till our scheduled end time. Why don't we take a vote on this motion and we'll see where it lands. So all in favor of the motion made by Commissioner Kearns to recommend 2 names to the county commissioners, allowing them to decide as a result of the stalemate, please say aye. Aye.
Aye.
Any opposed? Say nay.
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 And abstaining. Okay. Well, I guess the only thing left to do is to defer this to the to the February 19 special meeting of the Board of Health. Is there a motion to defer this item to that date?
I'll make that motion.
Is there a second?
Second.
I'll second.
All right, we've got a motion and a second. Any further discussion?
I'm done.
Sorry, so I wasn't aware about a meeting on the 19th, but is that since we'd already blocked off time for the AO interviews, is there an intent to have a meeting that day?
there
Okay,
is.
I didn't know
Yes.
anything about
Yes.
that, but I guess my calendar is blocked off. So, okay, so we plan to have a special meeting on that day.
Yeah, it doesn't need to be long, although this may add some length to it. We'll see.
Okay, thank you for the
Thanks.
clarification.
Yeah, please go ahead.
I'm not sure what we're going to be gained by deferring it, but
Yeah. All right. Patricia.
Yeah, that was my question. What does doing it on the 19th do that we are not able to do in the meeting today?
I don't know, but we obviously cannot come to a decision today. Every avenue has been attempted and failed, and therefore I don't see any other option but a deferral at this time. And I too would like to vote no on it, but in terms of being reasonable, I will support the motion. Anything else? Seeing none. Okay, all in favor of the motion to defer this item to the special meeting on the 19th, say aye.
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 Any opposed?
nay.
Nay.
And abstaining. Okay, I think that passed, if I heard correctly. Ann, is that your?
That's correct. I
Okay.
have 2 nays and the rest are yeas.
All right. So, all right. Well, we have our 2 recommendations. This will be deferred to the 19th. We will come back then, and hopefully we will either discover a path or a clear decision. So with that, there's nothing else on our agenda for today. I'm going to,
Can I just interject something and just ask?
Very briefly.
Michelle, can you follow up on that a little bit more and make sure, just to verify that we're doing everything correctly at this point and have that for the meeting on the 19th?
Yes.
Not that you haven't done that. I know you've done your diligence here already, but can you just take a little bit more inquiry to see if there's something that we missed in this meeting that needs to be considered on the 19th.
I would be happy to do that. And I also will try and put together a little memorandum for all of you that has the relevant statutes in it to make it easier for you to see exactly what's required.
All right.
Thank you.
Thank you, everybody, for participating, and we will see everybody back on the 19th. With that, we are adjourned.